everyone, how are you all? Welcome back to my channel. My name is Yana. I'm a second year RN student at Sunshine Coast University, and today surprisingly I have time in the first part of the day to film this video because at the moment I'm undergoing my placement, and this week I'm on PM shifts, so I can catch this beautiful sunlight in my house and record some videos. And then my next week, which is going to be my last week, I will be back again to the morning shifts, which means I'll be coming home when it's also like almost a sunset. So yeah, so I'm really happy that I can actually record during this week some videos for you. So while it's still relevant to me because I'm still undergoing my placements, I decided to film this video talking about how can you get the most positive feedback during your placement, whether it's from your body RN nurse or whether it's from your facilitator that will be of course sent to your uni, and just how to stay a good and safe student in general. So I put for myself some points in my notebook so I could stay on track and not to forget things. And if you don't mind, I will stay wearing my stethoscope because it just makes me feel special. And okay, let's get started. So the first point that I wanted to talk about, once you know your allocation, okay, I would suggest to you to go onto website of the facility that you're going to go for your placement and just read about it, you know, see what type of services they provide, you know, have a look at the unit or the ward that you will be sent to, what it is about, what type of patients go there, what type of conditions they treat. You know, you won't maybe find a lot of information in terms of cares, but at least it will give you some of sort of indication what to expect, you know, and also just see where the facility is situated, you know, physically, so you can know how to get there by your card. Just see the information about parking. Like for example, some of the facility have limited parking options for the staff because they give the majority of parking to the visitors and some parts for the doctors as well. So just see where you're allowed to park, for example, because it is important and time consuming once you come to your first day of placement to find the parking, you know, just to find the entrance to the facility, knowing how to get to the facility, whether you drive by yourself or you catch a public transport. So just research all that information. It's very easy. All the facilities these days obviously have information online. They have their own websites and stuff like that, so you will see how handful and helpful it will be for you once you show up on your placement. Second point that I wanted to mention is come in time. Just allow for yourself at least half an hour to come earlier, again for the same reasons, just to find the entrance to the placement, to the facility, you know, find available parking. Sometimes it could be even off-street parking, like depending on the facilities. I had both in my experience. And yeah, just find out where the staff room is, you know, or if you've been told by your facilitator that you're meeting, let's say, on a specific point in the facility, just find that point, you know, get yourself ready, you know, maybe go to toilet or something, because I can assure you will be nervous on your first day of placement. You will be worried, you would be a bit scared, so you will feel like you need to go to toilet. You just make sure to do all of that and be ready to start your placement. Next, I want to talk about look presentable. So obviously your university will give you sort of like an outlined information regarding your appearance. That will include your uniform that you have to wear actually every shift. So you have to make sure that you have your scrubs or your polo t-shirt. Depending on a uni, you will need to have a black bottom, whether it's a skirt below your knees or whether it's pants, no tight pants and stuff like that, you know. So you will need to have particular shoes, you know. Your hair needs to be tight. Like, see, like now for this video my hair is untied, but when I go to my placement, which is almost in 1.5 hours, I have to leave my home, I will tie my hair back, even though I don't have really long hair. But if I do any cares and I pan down to the patient, you know, it goes in my face, and I don't want to be like touching it with my hands all the time, fixing it up, because most of the time I wear gloves, so you know, it's not the proper infection control. So yeah, so they will tell you all of that regarding jewelries and stuff. Make sure always that your uniform is ironed, like especially if you wear scrubs like me, I have to make sure that it's always ironed if I wash it, you know. And just keep yourself nice and professional and clean every time you show up on a placement, because it's not only the patients that you're dealing with, you're also dealing with different type of medical personnel. That could be doctors, that could be physio, speech pathologists, dietitians, your nurses, you know. Then you will have the relatives and family members of the patients as well. So when you practice in a specific facility, you're representing not just yourself, but also the image in general of that facility that you practice. So just think about it that way. And yeah, this is why it is important. Next, get your documents ready. So if you watch my previous videos regarding placements, I advise that you have all your documentation in one folder, and you will need to have this documentation on your first day of placement. So do not forget it, it's very important. Some of the unis would tell you it is so serious that you may be actually turned back home if you do not have your documentation with you on your first day of placement. So make sure before your placement starts, like a few weeks in advance, make sure that you have all your certificates done, you've conducted all your online modules for that specific facility that you're going to. You have all of that organized and ready to go, because sometimes even registration on websites takes up to 3 days, so just keep that in mind. Next is when you start working with the other nurses, just see it as working in a team. Okay, communication is very important. Be respectful and polite to your nursing colleagues. Even though you're in a position of a student and the other nurses are employed in that facility, yet you still have to practice professional communication with them. Okay, just if you have any questions, ask them. If you have something to suggest, talk to them, obviously, you know, and just work as a team. If you see that your nurse needs help, just don't be afraid to offer that help by yourself. Show some initiative. You know, if somebody asks you for help, you know, just do it. If you don't feel comfortable, you can openly say that I don't feel comfortable, would you like to show me first, or would you like to send someone to assist me, or something like that. But in the end of the day, you all work as a team. There are certain numbers of tasks that need to be done, certain types of cares and stuff like that. So just working as a team is very effective to finish all those tasks before the next shift come. Next that I wanted to mention is administration of medication. So you as a student, obviously you will be told by your university hundreds of times that do not administer medication by yourself, and just following those procedures will make you a safe and good student, and definitely will give you good feedback by the nurses that will be supervising you, because administration of medication is very important and there is no place for errors in this matter. So just remember always to follow safety when you administer medication. Always do it under supervision of your nurse. Always check your patient rights, you know, for allergies as well and things like that. Know the medication that you are administering at least as much as you can. If you don't know it at the moment of administration, you can look at the indication in the medical chart, or you can ask the nurse beside you, or later on you can have a look in Harvard's or in memes that are available in drug room of every hospital. And yeah, just educate yourself and follow safety. This is very, very important. I would say that medication part in the whole placement is the most important part of all. Second, do not afraid to ask questions. Like a lot of nurses told me when I was doing my even EN placements, and they will tell you that they feel more comfortable if they see students asking questions than if they act like they know it all, because they know that the person who asks questions, he's trying to stay safe. He's trying to look for knowledge and for information before they do or perform certain tasks. So it's better to actually ask questions and show that you're willing to learn and you're willing to stay safe than act by yourself, you know. And sometimes if you have a question but you're shy to ask the question, you might do a mistake when you perform certain cares. So yeah, just don't be shy to ask questions. They will love you for that. Like, obviously you're not going to be asking questions like every single minute but if you have any questions, obviously ask. Do not be shy. Second thing is regarding patients as well, is when you feel comfortable, try to take a patient load, okay? And even uni will tell you this as well, because this will help you to practice your time management. This will help you to practice also cares on those particular patients. This will help you to concentrate on medication that they take. Just research more about it and why that particular patient take these particular medications, you know, how is that connected to their treatment of the conditions that they have and stuff like that. So also for certain tasks allocated for you by your uni, like for example your reflection or your goals set and stuff like that, taking a patient load will be helpful because you can concentrate on your goals, you know, and your reflection regarding to the cares that you provided for those 2 or 3 patients that you took a load of. So, and also nurses will like you for that as well, because you will sort of help them as well. But it doesn't mean if you took a load of the like 2 or 3 patients that you will be you by yourself only doing cares for those patients. No, still safety applies in terms of medication administration. You will still need RN to supervise you. If there are any transfers, you will need a second person to be assisting you if the mobility of the person is to assist, for example. If you're taking the cannula out, if you're changing IDC or things like that, if you're doing subcuts or IMs, you will still need to be supervised by your RN buddy. Okay. Next, try to learn and practice on writing progress notes. Okay, you will need to do this because this is part of nursing sort of job. Most of us nurses, we need to write progress notes by the end of our shift and outline the cares and other tasks that have been done to the patients. So take initiative. You know, you don't have to do it on your first day. You can do it on your 3rd or 4th day, or maybe even 2nd week, but at least you can try to look at the progress notes of the other nurses, see what they write, you know, how the progress note order goes, you know, and things like that. And maybe try to do it on a blank paper, you know, show it to your nurse buddy, let them read it, you know, things like that. And then when you feel comfortable, you can actually start to already transfer those progress notes into the files of the patients. Okay, so obviously your facilitator will like you for that, because this is part of the nursing job. As I already said, this is something that you need to practice along with the handover as well and the other cares that you provide. So just take the courage, you know, try to do it until you feel like you're comfortable, because yeah, like you will help also your nurses, because by the end of the shift they have to write progress notes on 8 to 9 patients that they're looking after. If it's 2 nurses, you know, per this number of patients, and if you take 1 or 2 patients you know, out of that load and write those progress notes, you will help them physically by the end of the shift. You will be told so many times by your facilitator and by, like, not told but reminded by your uni and your facilitator that do not just stand somewhere in a ward or in a uni doing nothing. Okay, sometimes you will feel like there is nothing else to do, you know, this and this and this been done, and I have a little bit of time now, like where there is nothing else is coming, nobody's buzzing, you know, there is no call bells going on. Well, this is not the case. There is always something to do in a ward or in a unit. Okay, if you don't have a specific task, just go through your patients, see if anybody, you know, needs assistance with something, see if anybody are comfortable, just ask even if anybody have pain or something like that, you know, just see if they need something, you know. Maybe just go and put the towels, you know, near to their beds, you know, just a small towel or something for the hands or something like that. yeah, so there are always tasks to do, but even if you can't find something like that, okay, go to a room where you have all the medical charts of the patients, you know, their files and stuff like this. Have a look through the progress notes, you know, learn about that. Have a look at the conditions of the patient, you know, or go to the bedside medical chart. Have a look at what medication that person is on. Go grab Harvard, you know, or memes, and just sit down and, you know, research for your medications, you know, and write them down for yourself, you know. Go through the care plans, you know, see how those are organized. So there are always things to do, but do not give that impression to other nursing staff and to your facilitator if they come like suddenly to the ward, you know, to check on you, that you just like standing doing nothing. It's not a good image, you know, for you as a student and for the facility as well. Look for opportunities to practice. As I mentioned earlier a little bit, if you have, for example, if you know that certain patients are due today for the dressings to be changed, you know, and those patients might be not those 2 or 3 patients of your patient load, you know, just speak to the nurse and ask her, can I, you know, try to change the dressing, and you just assist me, stand beside me, you know, and just correct me if I'm doing something wrong, you know, or just guide me. So always look for these opportunities. Or if you know that a patient needs a cannula to be taken out, speak to your nurse and see if she can allow you to do that, you know, or do BGLs, you know, or do neurovascular or neurological obs, things like that. So like you will have about 8 to 9 patients, as I said, divided by 2 nurses. You will be attached to one of those nurses looking after these patients. So you will have heaps of opportunities coming. Do not be afraid to perform a new task just because it's new. You can always ask your buddy nurse to be beside you and guide you and help you. So you need to start. If you don't take that opportunity to start and practice, when will you? You know what I mean? There is always a beginning to a new task, and obviously every person worry and feel scared when something new comes, but you need to take that step, like, you know, to overcome that, and then it becomes your habit. Like, you will know how to do it, and it will become easy, and you will think like, oh my god, why I was so scared, like you know. So yeah, learn unfamiliar meds. So as I said, you can grab your patient chart and learn it from there, or you can have something like that I have here. So it's a small pocket book, and I showed it already like 100 times in my videos. It's a small medication pocket book that I write all my meds in here, you know, its side effects and indications, and also routes of administration. And every time I come about unfamiliar med, I just put it here. And also what I want to share with you in a description box of this video, I have a list of medications that's been given to me by my facilitator at my current placement now, and it's a 2-side paper. It has SA and S4 drugs, it has topicals, mixtures, food, something like a resources or sustagens. Then it has IV drugs, your oral tablets and capsules, oral antibiotics as well, IV antibiotics, eye and ear drops, strips and patches, and inhalers and stuff like that. So these are the medications that's mostly used in a unit that I'm practicing at the moment, but I can tell you that a lot of this medication you will find in other wards like medical, surgical, you know, and stuff like that. So if you want, I can take a photo of this or scan it and attach it as a link to my Google Drive, so you guys can download it, and you can, these are just the names. All what you need to do for yourself is just research each medication or use Harvard. It's up to you, whatever resources you have, and see its indication, you know, and obviously route of administration is here already stated by saying that it's oral, you know, or IVs, but you can see if that medication can be given any other way except oral, for example, or IV. Maybe it could be subcut as well. And yeah, and just see the side effects and put it in one of the small pocket books. So I have this one. This is for me as my RN placements, and I have 2 pages here like this. This was given to me about a year and a half now ago, when I used to do my EN placements at Diploma of Enrolled Nursing at TAFE, and one of the CN nurses that I had with her a few shifts, she gave me this list of medications, and this was from medical ward. Yeah, so if you want, I can scan this one for you as well. And another thing that I wanted to mention is you can go online to something called Australian Commission on Safety and Quality in Healthcare Recommendation for Terminology. Okay, I have this PDF file on my computer. If you don't want to research, I can link that as well in the description box below. What this document gives you is that it will give you all the medical abbreviations. Okay, so for example, for dose, frequency and timing. Okay, so what means BD, what means TDS and stuff like that, what means NG, nebulizer for neb, you know, sorry, neb for nebulizer, you know, and stuff like that, or your IDC for catheter. And then it will give you also units of measure, its abbreviations as well. And here it will tell you the mistakes, that how you should not write abbreviations and why, and how it should be write correctly. So if you want, I can give you PDF to that. This file has helped me a lot when I started my EN placements, because all your care plans, all your progress notes, you know, your handovers, you know, printouts, they will all have abbreviations. Even your medication charts, you know, it will have BD, for example, for BGLs, you know, so it means twice a day and stuff like that. So you will need to know that, you know, but again, if you don't know, you can ask your nurse. There's nothing wrong with that. So I will give you those files. Regarding also your calculations of medication, you can go to your website called ifolio.com.au and buy set of cards like that. Okay, it will have all the information for you gathered into small cards, so you can access it really easily. So this one, for example, here is for your medication calculation formulas, including your IVs as well. And here are your flow rates as well at the back, which are pretty standard. So you can hang this to your nursing bag and have it with you at all times, and that will help you as well. So that was regarding your medication. Okay, next, when you will be in a particular facility, you will be even told by your facilitator to follow policies and procedures of that facility. I will tell you that in generally most of the policies and procedures are very similar from facility to facility. But if you, for example, in the private sector, you might have a little bit different add-ons to their policies. So just you might be told about this on your introduction day, or just ask your nurses if you're not sure about certain things, because do not compare your previous placements to your current or next placement, you know, because as I said, some facilities will have different policies and procedures and protocols. So just find out this about the facility that you're practicing to make sure that you're staying up to date and you are safe in what you do. Do not perform, I wouldn't say like any tasks, but most of the tasks without supervision. You may perform OBS, for example, check vital signs of your patient by yourself, and sometimes you will be asked by your nurse to do it. But in terms of, as I said, like taking cannula out, you know, or for example, transferring someone who is to assist, or for example, you know, changing dressing by yourself, do not do these things by yourself, okay? For changing in dressing, it has to be a specific date for it. Sometimes it needs to be a specific order from the doctor as well, especially if you work in, especially if you practice in a surgical ward. So just make sure when you attend call bell, for example, if your patient is buzzing, you know, just make sure that if there is anything like what I just mentioned need to be done, you know, or some things like, you know, if you find that a person, for example, complains of pain in a certain side of their bodies, you know, something like that, just make sure to always call your nurse, you know, and do tasks and provide care and help by being supervised by your RN buddy. Okay, if your RN buddy on a break or something at that point, call another nurse. Whoever nurse is available, just call them to come and assist you. take part in handover. So this is a good practice as well. Again, you're not going to be asked to give handover in your first shift. You can do it maybe midway of your first week when you feel comfortable, but definitely if you started to take a load of a patient load, like for example you started to look after 1 or 2 patients, try to practice to give handover about those 2 patients, you know, during the general handover where all the nurses doing it. So it will help you to practice and feel more comfortable when you're talking to sort of like an audience. It's still audience, you might have like 10 people sitting, you know, and be present on a handover. So just practice, you know, to do a handover. Just see what you're saying, you know, see how you feel when you have people, you know, you're looking at you while you're giving information. You know, this will give you more confidence once you start to practice more and more and more, to the point when you feel completely comfortable, you're not scared anymore, you know, you don't miss things that you wanted to say, you know, because sometimes when we are scared or worried, we miss things that we want to say, you know. So everything comes with practice and experience. But at the beginning, you are welcome to write down the points that you want to talk about on a piece of paper. You know, have your handover sheet in front of you, have your planner in front of you to see what task's been done to that person and stuff like that. So that will help you as well in the beginning. So the next point that I wanted to talk about, you as a student, you can observe other nurses when they you know, communicate with patients, when, you know, when they educate patients, when they talk to their families, you know, and just see how they do it, see what information they provide, you know, what type of communication they practice, you know, how they behave, how they talk, you know, and stuff like that. Because this is part of our nursing standards for practice. We need to educate patients, we need to provide information, not just to the patients, but to their families as well. So you definitely as a student at some point will be practicing that, because sometimes you will may have a patient who can ask you why I'm having this medication, or, you know, if they are allocated, for example, for certain tasks, like for example for a blood test, the patient may ask you, why am I having a blood test, you know. So you can actually educate the patient, you know, why the blood is going to be collected, you know, for example, if there is any risk of some infection or something like that, or if a particular medication given to the patient, you can explain why that medication is given, you know, what condition it can treat, you know, how it can help. You don't have to go into really like difficult medical terms. You can just explain it on a really easy language, because those patients are not, you know, medical professionals, they just normal people, and if you make it simple for them in terms of explanation, it will make more sense. So yeah, so obviously observe other nurses, how they do it, just learn from them, and maybe taking in notes when they educate patients on certain health conditions or preventions, for example, you know, of symptoms and stuff like that for those conditions. Especially this is happening before the discharge, because you need to give information to the patients how to prevent certain symptoms so they won't come back again to the hospital. Use your planner to stay organized, okay? This will definitely make you one of the best students, like seriously, because planners are there to help you to keep on track with your tasks, make sure that you done all the tasks that needed to be done, you know, throughout your shift. And also your planner will give you some sort of indication when you give your handover in the end of the shift. So for me personally, I love planners. Some of the facilities you will find that, for example, if you have your 8 or 9 patients and you have 2 nurses working on those patients, you will find that they share only one planner. So one of them will do a planner, and then that planner will stay on a trolley in some part of the ward, sometimes in the nursing station. And every time you as a second nurse, not as a student, but for example, if there are 2 nurses and then you as a third student with them, if any of you or the nurse have done a particular task from the planner, you can go to the planner and cross it out. Like for example, if you've done a BGL on a particular patient that was due, let's say, prior to lunchtime, you can go to the planner and cross it out, so the other nurses can know that that task has been done and they don't have to go and recheck. Okay, some of the facilities will have that every nurse will have their own planner, and then they just, you know, cross-check who done what, you know, and just cross it out. So I guess it's just depending on the habits and rules of the facility. what's more comfortable for the other nurses to work, you know. So yeah, I had both situations, you know, when each of the nurses had their own planner, and in the facility where I'm now is just one planner for team of us 3, so me as a student and 2 other nurses. Yet because I'm learning my time management and because I just want to stay on track as well and just keep my planner with me everywhere, I have my own one. But once I've done something, I go to their one and I cross out the task, you know, and I cross out on my one. So it doesn't harm anyone as long as we all stay on track on our tasks and finish them in a timely manner. This is what's important. Follow privacy procedures, okay? Do not talk about patients out of healthcare settings, not even in elevators or even in the corridors or outside the doors of the facility while you're still in the territory of the facility. Okay, and you will be told by your uni about this many times. You will be reminded about this by your facilitator. This is very important, and we as healthcare professionals should maintain privacy of our patients in the walls of the hospitals. Okay, even when I'm filming videos, for example, I do not mention ever the facility where I'm going to. I never mention names. I do not talk in personal about patients, you know. If I made a mistake on a placement or a nurse made a mistake, I would never disclose this in my videos or something like that, not even if it would be something that I've learned not to do it myself. I would not talk about this in that way. So this is very important. Do not talk about patients on your social media, you know, or not even in the private messages with your friends, because whatever you put in the social media will always stay in the social media, you know. It cannot be erased, and today someone who is called your friend might be against you the other day, you know, and just make something bad, you know, and maybe put your information somewhere. So do not share any private things that you come across at your facility where you practice or where you work as a healthcare professional. Just simple as that. Do not be afraid to suggest things. Like, for example, I'll just give you a really quick example. It didn't happen to me, but it's just out of my head. Let's say if you found a patient that looks a little bit disorientated and a little bit confused, you know, and stuff like that, and you've noticed it already a few times, and I'm not talking about dementia patients now, like somebody who doesn't have dementia, but maybe even with dementia, it will be just more severe if they feel more confused. But if you find those symptoms in a patient and you notice it already a few times throughout your shift, but before your patient didn't look like that, you know, it was more alert, more aware of what's going on, where they are and stuff like that, you can suggest your nurse to do a UA test just to exclude the possibilities of UTI infection, because sometimes when people have UTI infection, they do feel disorientated and confused, you know, at the same time. Also, it could be a result of dehydration. If someone, especially if it's an elderly patient, they do not eat or drink very often, you know, they have poor appetite in most of the cases, unfortunately, you know, and you have to prompt them to actually drink their fluids, you know. So you can talk to your nurse and just suggest, how about if we will do a UA test on that patient, or how about if we will push more fluids to that patient, but just make sure that the patient is not on a fluid restriction. Okay, so yeah, do not be afraid to suggest, because sometimes you might be right and you saw the symptoms right, like they do exist, but you neglected it. You were afraid to actually talk to your nurse about it, and the condition that could be present was neglected. It was left unnoticed. So yeah, anyways, UA test will never harm anyone. It's very safe and harmful procedure, so if you do it just to exclude the possibilities, it will be just something that will be beneficial to the patient. As usual, my camera is just, the battery is going off and it's just crazy. Maybe it just indicates that my videos are too long. Oh my god, I just wanted to cover like the most of the things you know, that I came across, and I just wanted to advise you certain things, and I think I have too much, but anyway, we're almost done. So the next thing that I wanted to mention is don't be afraid to answer call bells. Okay, sometimes you will find that your nurse is, for example, busy in a drug room, or your nurse is busy with a particular patient, you know. So if you see that the buzzer is going on, you know, just go and see what that patient wants. It doesn't mean that if you go, you have to like perform whatever it needs to be performed. You can still call for assistance, you know, you can find out what nurse is looking after that patient. But just in general, you know, if you hear a buzzer going on, you know, a call bell, just go and answer it. Because as I said in the beginning of this video, we all work as a team, whether you are a student or an employee. So yeah, it's just go simply and see what the patient wants. Sometimes it could be just a glass of water they want, or sometimes they would want you to help them to find the button on a remote control to put the TV on. So yeah, it could be really simple things. The next thing I wanted to mention is to follow your infection control procedures, especially your hand hygiene, okay? It's not like the nurses will be watching you whether you wash your hands before and after procedures and stuff like that, but they will notice if you don't. So just following proper hand hygiene is very important for you and for the patients as well, and for the facility in general. But this will just also will indicate how responsible and safe you are during your placement. And yeah, so when you will be when your nurse buddy will be filling in a feedback form that you will need to give after each of your shifts to your nurse buddy, they can actually mention if you were not washing your hands. So just be mindful about that and follow that procedure at all times. Okay, the next one is know your normal ranges for vital signs. Okay, you can make a card and have it with you at all times, like I've done when I was at my diploma of internal nursing at TAFE. Okay, so I have my normal ranges of vital signs for adults. So I have temperature, pulse, respirations, blood pressure, oxygen level for normal person, and the person who has COPD condition or maybe some other respiratory conditions as well. And then I have at the back my administration of medication, patient rights. Okay, and you can do this by yourself. You can print out a little paper like that, and then I put a plastic around it, you know, and just keep it with you all the time. Or you can just make it on a hard piece of paper like that, you know, and just maybe even write it with your hand and have it with you all the time. It's very simple, but if you're starting your placement at first time, you know, you might forget them because you just started, you don't know it, but with experience and practice, you will just memorize them like correctly and you will know it by heart. But obviously if you're a new student, this will help you a lot. And you can pin it to you know, to your nursing ID, to your nursing patch, and it will be easily accessible. And the last thing that I wanted to mention is that if you go on a break or if you finish in your shift, please let your RN buddy know. Do not just disappear from the hospital, okay? Or do not just disappear to even toilet or to lunch without notifying your RN, because in the end of the day they're responsible for you there at some point. Secondly, it's more polite if you let your RN nurse know where you're going, you know, so she wouldn't be or he wouldn't be looking for you across the whole ward or unit. Okay, so yeah, and in the end of the shift, just make sure that you told your RN that you are leaving, and just see if everything else been done. She doesn't want anything from you, you know, and things like that, and then you can leave. So these were the most points that I wanted to talk about. I know it became too many. To be honest, I didn't want to make this video too long, but at the same time, as usual, I wanted to share with you some of the things that are relevant and important to me and I came across during my placement. And I think if you will be following most of these points that I mentioned, you know, or maybe all of them if you can, it will definitely make you a good student and will make other nurses to and actually help other nurses to give you a good feedback, you know, because remember, your feedback during your placement is very important. It will be taken to your university, and in my university, for example, we actually have a feedback form, which something I didn't have with TAFE. With TAFE, we just had like our facilitator with us in a facility, and she could just like tell us feedback midway of the placement and in the end, you know, and then just report that feedback to TAFE. But here in a uni, we have actual form of feedback that we have to give to the body nurse that was supervising me on that particular shift, and I have to give this feedback form each and every shift I go to that facility. And then once that feedback form was filled in, it will have actually areas to improve and areas that were done successfully. It has tick boxes that the nurse has to do, and once that is done, I have to collect it and give it to my facilitator, and I think she collects it and give it to the university. So yeah, so this is why it is important to get the good feedback. And also, if you really like the facility where you had your placement, and maybe in the future when you finish your diploma or degree, you know, you would want to work in that facility, just remember and look at your placement as a job opportunity, because it's not like everyone will forget you. No, if you want to apply for the job in that particular facility, in that particular ward, because you were familiar with the tasks and cares in that ward, it is important for you to have a good feedback during your placement, so that those people can remember you as a good student, as a safe practitioner, you know. So yeah, so just look at it at that point. This is all what I wanted to say. I'm sorry if this video was too long. I didn't plan it to be too long, as I said, so I better be going now. I have like half an hour left now to get my lunchbox done. I'm already dressed, so this is good. And yeah, so I'll try to film more videos during this week, and I'll try to upload them at evening times when I come from my shifts. I'll see you in my next videos. Bye.